New South Wales Premier is warning October is going to be the worst month for hospitalisations. If the system's struggling now, how's it going to cope then?
As Sydney's COVID outbreak grows, so does concern about future hospitalisations.
Is this the biggest challenge that we're going to have as a health system? And will we be in crisis? I'm really confident that we have plans in place.
Our surge capacity, we estimate, is in excess of what we'll need. But as you know, all good planning means you prepare for more than what you think you need.
With nearly 600 cases expected in the state's ICUs by the end of October, specialists are bracing for challenging weeks ahead. Sydney-based Dr. Mark Nichols is Vice President of the Intensive Care Society.
Intensive care are usually full. They're expensive to run, and so they're a finite resource. And so usually we're running at high like 80 to 90% capacity. So that's the normal state of play before the pandemic, and that's why it was so important that we put plans in place to increase ICU capacity and decrease ICU demand during the pandemic.
State and federal leaders are still thrashing out how the country will live with the virus once vaccination rates reach higher levels. Dr. Nichols says all options are being canvassed to cope with a future surge in cases. This could include flying COVID patients interstate to areas with fewer cases to relieve pressure.
To be honest, that is a possibility that's being considered. We do have a critical care advisory group that's chaired by the federal government, and that group's been formed to look at those particular questions.
But health systems in so-called zero COVID states are already stretched. In South Australia, major incident alerts were declared at 2 hospitals last week due to emergency department demand. And more than 11,000 Tasmanians were on the elective surgery waiting list in June.
To be honest, most departments are running at almost disaster level, at least several times a week.
In July, emergency doctor Peter Arlely spoke to 7:30 about WA's strained health system. A month later, ambulances in WA spent more than 6,000 hours waiting to unload patients, a new record for so-called ambulance ramping.
If we did have an outbreak, which we're doing everything we can to prevent that, you take further measures, which is what New South Wales has done.
Hundreds of medical staff from overseas are being flown into Victoria and Perth. COVID-free states are trying to boost vaccination rates before opening domestic borders, but are being warned local infections remain an inevitability.
There is one thing you cannot escape in the COVID-19 pandemic, and that is that you will eventually have COVID-19 patients in your emergency departments, your wards and your intensive care units. So if you are in a lucky enough position to be in a COVID zero state in another part of Australia, you have to be as prepared as possible.
Health Minister Greg Hunt says there are 7,500 ventilated ICU beds across the country. But ventilators and beds still require staff.
It's very fatiguing wearing the respiratory precautions with the N95 masks, the gowns. So it is fatiguing on staff. So we are worried about the ability to care for non-COVID load as well as COVID over the months ahead. But as we always do, we'll juggle resources.
Dr Chris McIsaac is the head of ICU at Royal Melbourne Hospital. He says while staff are preparing for a potential influx of cases, many are grateful to be vaccinated this time around.
They feel much safer in 2021 than they did in 2020 because they're all vaccinated in the intensive care unit. Yet last year, thanks really to the Victorian public, the public health system was not overwhelmed and we did cope well. And we had much higher numbers in 2020 than we're seeing at this juncture. But obviously we're watching what's happening in New South Wales and preparing for the possibility of increasing numbers in the weeks and months ahead.
The staff filming,
So on my ward, we had to furlough 90 staff, but across the hospital, hundreds, I think about 400 staff, if not more, had to be furloughed and go into quarantine for 14 days.
Adam Bonza is a fully vaccinated nurse unit manager at Royal Melbourne who just spent 2 weeks in quarantine after being furloughed when a COVID-positive patient came in for surgery.
The impact is a terrible thing. At a time like this, you want to be working, you want to be helping your team, helping your patients, and you're not allowed to.
The Prime Minister wants hospitals to avoid standing down healthcare workers who are close contacts of cases.
Once we particularly move into these new phases, if you're vaccinated, you shouldn't have to be furloughed.
Victoria's Health Department says it has developed new risk-based guidance that will keep more vaccinated hospital staff working. It says furloughing policies are flexible and could change as vaccinations increase.
I think if you've got the exposure and you've got the vaccinations on board, we will get to that situation where we won't need to be furloughed. We'll go into quarantine.
Former Deputy Chief Medical Officer Nick Coatsworth was involved in the surge capacity planning back in March last year. He's concerned about flow-on effects on the health system from emergency measures, including cancelling elective surgeries.
There's always a debt to pay here in terms of catching up on elective surgery. The message needs to be to Australians who have chronic medical conditions. Your health service and your hospitals and your GPs, they are safe places, and you need to keep getting your care for chronic conditions that are non-COVID, as well as getting yourself vaccinated for COVID.
Only a very small percentage of those currently hospitalised for COVID have been vaccinated. Still, healthcare workers are preparing for a tough few months ahead.
I see great spirit amongst nurses and doctors, but in what is already a high-intensity job where you give your all for your patients, it's one added thing, and it's just putting pressure on us that we will do our best to manage, but it's just going to be really tough, I think.
The best thing that can be done is people to be vaccinated, because that will take pressure off our staff.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.